So with the rising fashion of facial hair and lack of evidence-based beard care routine, there has been patchy information about beards, until now. So if you want to know an evidence-based beard care routine growth and treatments, then this is the video for you. Now I know what you're thinking, why is a biological female with no facial hair giving me advice on beard? Aside from the few occasional chin hairs, I am a dermatology specialist trainee doctor. Hi, my name is Dr.ErmaDerma, and I've collated this information from research articles, clinical trials, guidelines, and of course, everyday practice from treating patients with beard problems. So in this video, we are going to go through number 1, an evidence-based beard care routine. Number 2, beard problems and how to treat them. So we're going to go through the causes and treatments of patchy beards, ingrown hairs, dandruff, beard acne, fungal beard infections, and how your mental health can affect your beard. And number 3, how to achieve a fuller beard, where I'll discuss Minoxidil, other treatments, and beard transplantation. Of course, timestamps will be included in this video, so you can pick and choose on what you want to listen to. Let's get into the thick of it, shall we? For your beard care routine, there's not that many studies and evidence addressing these topics. However, as dermatologists, general recommendations include cleansing. So this is your first step. This is important since your beard can trap dirt, oils, germs, pollution, dead skin cells, and debris, and thus affect your skin, and this can clog your pores and irritate your skin if you do not wash or cleanse your beard regularly. So you want to use a cleanser according to your skin type. If you have oily skin, I would suggest to use a Salicylic Acid, Benzoyl Peroxide, or glycolic acid. Make sure you leave this on for a few minutes so you have given time for these active ingredients to work before washing off. If you have a normal skin type, keep it simple with a simple cleanser, ensuring your skin's pH balance stays intact. And if you have dry skin, hydration is key. So opt for a fragrance-free hydrating cleanser to moisturize your skin. And if your skin is feeling a bit sensitive, i.e. your skin easily burns or reacts to products, use a creamy facial cleanser labeled soap-free and fragrance-free. These type of cleansers are your best friend. Some recommendations for normal dry sensitive skin include Cetaphil Gentle Skin Cleanser or CeraVe Hydrating Cleanser. You want to gently massage these cleansers into your beard and skin using circular motions. Afterwards, you want to rinse thoroughly with lukewarm water. And then you want to pat your face dry with a clean towel, leaving the skin slightly damp, because this is going to help your next step, which is moisturizing. So applying moisturizer to damp skin really helps absorb your moisturizer. So try to moisturize daily to prevent dryness, flakiness, and itchiness in the skin beneath your beard. Other types of moisturizers that you can use are beard oils, balms, and wax, and all of these can soften the beard hair but also retain the moisture in the hair shaft and surrounding skin, and reduces water from escaping your skin. There is not that many studies, unfortunately, of the effectiveness of beard care products and which products are far superior than others. But what I would suggest is to avoid products which have irritating ingredients such as fragrances, including linalool and limonene. In terms of beard oils, yes, they have fewer preservatives. However, most of the beard oils have essential oils in them, which is an irritant to the skin. If you're using beard balms, other irritants to watch out for is tocopherol and lanolin. Although beard products contain various potential contact allergens, very few or no cases of contact dermatitis have been reported, i.e. significant irritation to beard care products have been reported, possibly because the concentrations may be below the threshold for sensitization or reaction. So if you have been using any beard care products and it has been working for you, then absolutely continue on with it. One ingredient I would like to mention is jojoba oil and wax. It was noted that it has anti-comedonal properties, which reduces whiteheads and blackheads, and anti-psoriatic properties, and has been linked to reducing hair breakage. However, jojoba oil has also been noted to increase solubility and penetration into the skin, and therefore, its use is cautioned with other products alongside jojoba oil. So then we get to step 3, grooming. So use a beard comb to evenly distribute the product through your facial hair. Use a beard comb to detangle wet hair, style your beard, and comb out hairs when trimming with scissors. When you are trimming your beard, to help prevent irritated skin, apply a shaving oil, cream, or gel before trimming your beard and use an electric razor to trim it. If you are shaving your neck or other areas to reduce irritated skin and other problems, we recommend that you change your razor blade every 5 to 7 shaves. You want to shave at the end of your shower or immediately after getting out of the shower. The heat really softens your hair, and you want to shave in a direction that your hair grows. Shaving against the grain can cause ingrown hairs in some people. And you want to rinse your razor after each swipe. To prevent bacteria from building up in your razor, you want to wash the guards of your razor and store in a dry area. And you want to apply moisturiser, beard conditioner or beard oil immediately after you shave. If you are thinking of dyeing your beard, then I would recommend to do a small patch test, either behind your ear or on your hand, because you may get an allergic reaction to an ingredient called p-phenylenediamine or PPD. And of course, always wear sunscreen on sun-exposed areas of your beard, or if you have a patchy beard or stubble. Try to apply sunscreen on the sun-exposed areas as much as possible, every 2 hours if you're out in the sun. So now we get into beard conditions. And one common beard condition that we see is patchy beards. Now, the most common reason for a patchy beard is genetics. Your genetics play a significant role in determining the thickness, distribution, and overall quality of your facial hair. If your family history includes men with patchy beards, there's a higher chance you might experience the same. So thanks, dad and ancestors. The other reason is hormones. So testosterone is a hormone that influences facial hair growth. Some individuals may have a high level of testosterone leading to denser and fuller beard growth, while others might have lower levels resulting in patchiness. But apart from hormones, it's also about your hair follicle sensitivity. So the hair follicles on the face can be more or less sensitive to your testosterone or hormones, affecting their ability to produce hair. Some follicles may be more sensitive and produce thicker hair, while others may be less sensitive and result in patchiness. However, there are conditions that can cause patchy beards, and it's not because of your genetics or your hormones. One of the conditions is called alopecia barbi. Now, people with alopecia barbi experience hair loss in patches of skin, leaving the affected area smooth and hairless. Alopecia barbi is a specific form of hair loss that affects the beard area. It is a type of alopecia areata, which is an autoimmune condition characterized by the body's immune system mistakenly attacking its own hair follicles, leading to hair loss. In the case of alopecia barbi, this immune response is targeted specifically at the hair follicles in the beard region. Treatment options for alopecia barbi include various topical and systemic treatments aimed at reducing inflammation and promoting hair regrowth. These treatments can include topical minoxidil, which you can buy over the counter, steroid creams, injections of steroids into the affected areas, alternative treatments including Janus kinase inhibitors or JAK inhibitors, which modulates your immune response, platelet-rich plasma, lasers, and cyclopropanol, which is like a sensitizing agent. The other condition which can cause patchy beards is frontal fibrosing alopecia of the beard. Now, this involves the destruction of hair follicles and subsequent scarring, leading to hair loss. This condition can result in the loss of hair in the cheek, chin, mustache, and sideburn loss, causing patchiness and a receding beard line. Other associated hair loss with this condition is a receding hairline and loss of eyebrows. The exact cause of frontal fibrosing alopecia of the beard is not fully understood, but they are believed to have an autoimmune component. The immune system mistakenly targets hair follicles, leading to inflammation, scarring, and hair loss. Genetic factors, hormonal changes, and environmental factors may also play a role. However, I would suggest to visit a dermatologist for this condition, since diagnosing frontal fibrosing alopecia of the beard typically involves a combination of physical examination, medical history review, and often a biopsy on affected areas to assess the extent of inflammation and scarring. Unfortunately, there is no known cure for these conditions, and treatment focuses on managing symptoms, slowing down the progression of hair loss, and potentially promoting some hair regrowth. Treatment options may include topical or oral medications to reduce inflammation, stimulate hair regrowth, or modulate the immune response. Treatment options for frontal fibrosing alopecia of the beard include topical medications like tacrolimus cream, which is available in varying strengths. Tacrolimus can help manage inflammation and potentially promote hair regrowth. Additionally, topical steroids have been used. Androgenic medications like finasteride have shown promise in treating frontal fibrosing alopecia of the beard in men. These medications work by inhibiting the effects of androgens, which play a role in hair loss. Studies have reported that these medications can improve hair loss or help maintain existing hair. For some individuals with more advanced cases of frontal fibrosing alopecia of the beard, hair restoration techniques like grafts combined with platelet-rich plasma have been explored. These techniques involve transplanting healthy hair follicles to the affected areas. Grafts combined with platelet-rich plasma have shown promising results, with reported high survival rates of 80% survival at 10 months. If you want to know more about beard transplantation, then you may want to stick around at the end of the video where I'll just discuss the basics of beard transplantations. So the second condition is beard acne. So when you grow a beard, your beard hairs trap oil from your skin, dead skin cells, and bacteria next to your skin. Without the right skincare, these can clog your pores and cause acne. So what you want to do, you want to get your hands off your face, avoid touching your beard and face throughout the day. Touching can transfer dirt, oil, and bacteria from your hands to your skin, which can exacerbate breakouts. Use a gentle facial cleanser with ingredients like salicylic acid or glycolic acid. These ingredients can help exfoliate and prevent clogged pores. Avoid using regular soaps or shampoos on your face as they can be harsh and cause irritation. In terms of cleansing technique, you want to apply the cleanser gently using your hands in circular motions. Be sure to clean both your beard and the skin beneath it. And you want to rinse thoroughly with lukewarm water, avoiding washcloth that can irritate the skin. And when you dry your beard, pat your face dry with a clean towel after cleansing. Using a dirty towel can introduce more bacteria to your skin, so ensure your towel is clean. And you want to apply acne treatments. So apply an acne treatment containing salicylic acid, benzoyl peroxide, or a retinoid. These ingredients can help control acne and prevent new blemishes. Apply the treatment not only to existing breakouts, but also to acne-prone areas. And when you groom your beard, regularly groom your beard using a non-comedogenic beard conditioner or moisturizer. This helps prevent dryness and itching in the skin beneath your beard, which can lead to increased oil production and breakout. And of course, patience. Acne treatment takes time to show results. It's recommended to use the treatment consistently for 2 to 3 months before expecting significant improvements. If you don't see reduction in breakouts after a month, consult a dermatologist for alternative treatment options. However, if you have beard acne or your acne is quite extensive, then I would suggest to visit your dermatologist. I've also done a video where I have talked about acne in detail in my How to Treat Your Acne in 2023. I'll put a link at the end of the video so you can check this out after this video. But if you are suffering from ingrown hair or razor bumps, the medical term is called pseudofolliculitis barbae. Pseudofolliculitis barbae is a skin condition that occurs when shaved or plucked skins curl back into the skin, leading to inflammation and the development of raised, red, and often itchy bumps. This condition is particularly common among individuals with curly hair, as the hair's natural tendency to curve can cause it to re-enter the skin. Afro-Caribbean people are more likely to get ingrown hair since the genetic structure of the facial hair has spiral or a helical-shaped follicle, which can result hairs that can tightly curl back into the upper layer of the skin. Now, pseudofolliculitis barbae can be a recurring issue and is often seen in areas where shaving or plucking occurs. However, don't worry, here are 9 preventative steps to stop your ingrown hairs. So you want to shave in the direction of hair growth. Shaving in the direction of hair growth can help minimize the chances of hair curling back into the skin and causing ingrown hairs. And you want to shave gently. Avoid stretching the skin while shaving, as this can increase the risk of hairs re-entering in the skin. Use short, controlled strokes and maintain a light touch. And you want to use sharp blades. Using sharp and clean blades is crucial. Dull blades can cause more irritation and contribute to the development of razor bumps. And you want to avoid overshaving. Shaving over the same area repeatedly can irritate the skin and increase the likelihood of ingrown hairs. You want to leave a bit of stubble around 1 millimeter to avoid excessive shaving in one area. And you want to shave using your non-dominant hand. Shaving with a non-shaving hand behind the back can help reduce the temptation to pull the skin taut, which can contribute to a closer but more risky shave. And you want to try different hair removing techniques. Experimenting with different shaving techniques, such as switching from a blade razor to an electric razor, can be helpful in finding what works best for you. And you want to reduce your shaving frequency. So, shaving less frequently, such as every other day, can provide the skin with more time to recover and reduce the occurrence of irritation. Growing facial hair for at least 1 month is first line treatment. After shaving, make sure you moisturize and exfoliate. Keeping the skin moisturized and using products containing glycolic acid, salicylic acid, benzoyl peroxide, and retinoid can help exfoliate the skin surface, reducing the chances of new inflamed spots. By incorporating these recommendations into your grooming routine, you can significantly lower the risk of developing razor bumps and manage existing pseudofolliculitis barbae more effectively. It's important to remember that everyone's skin is unique, so some trial and error may be needed to find the combination of techniques that works best for you. Pseudofolliculitis barbae or razor bumps can often improve within a period of 4 to 6 weeks after discontinuing the hair removal method that caused the condition, particularly shaving. This improvement occurs because the hair has the opportunity to grow without being constantly cut and shaved, reducing the likelihood of it becoming ingrown and causing inflammation. Taking a break from the causative hair removal technique allows the affected hair follicles to recover and reduces the cycle of irritation and inflammation. During this period, you might notice a reduction in the number of severity of razor bumps as the skin heals. If your razor bumps are not getting better, then please do visit a GP or dermatologist to get treatments such as topical steroids, antibiotics, light treatments, and laser. However, if the red bumps are getting increasingly tender, painful, or hot, you may be getting an infection called folliculitis barbae. And you would need to visit a dermatologist or GP to get some antibiotics to get your folliculitis barbae and this infection treated. Okay, so let's talk about dandruff in your beard, or seborrheic dermatitis, the medical name. So this is a common skin condition that results in itchy, flaky, and sometimes greasy patches on the skin. To try to manage the dandruff on your beard yourself, here are some steps. You want to use gentle brushing of your beard every day before washing the face, because this can help lift the flaky skin and prepare the area for treatment. This practice can also improve the effectiveness of subsequent treatments. So if you can get a hold of hydrocortisone 1% solution, you can buy this over the counter. This can provide relief from the inflammation and itchiness associated with seborrheic dermatitis. This should be applied twice daily for 1 to 2 weeks. And use a dandruff shampoo. So regularly shampooing the beard and scalp with a dandruff shampoo containing active ingredients like zinc ketoconazole or selenium sulfide can effectively address dandruff. These ingredients have antifungal properties that can help manage the underlying cause of seborrheic dermatitis. For treatment, apply twice weekly for 2 to 4 weeks. Leave it on for 3 to 5 minutes before rinsing. To prevent dandruff coming back, apply every 1 to 2 weeks. And of course, lifestyle factors. A high fruit intake is associated with less dandruff, whereas stress may precipitate flare-ups. However, if the condition persists or worsens, it's advisable to consult a dermatologist for further investigation and treatment. Another condition is fungal beard infection, also known as tinea barbae. Now, tinea barbae is a fungal infection that affects the hair follicles of the beard and surrounding skin. This condition commonly occurs in adult men, particularly those with facial hair, as the fungus thrives in warm, moist environments. Tinea barbae can present as red, inflamed patches with pustules and crusts in the affected area. It's usually itchy and can be uncomfortable. Tinea barbae can be spread through direct contact with an infected person or animal, contaminated object, or sometimes from the individual's own skin. Risk factors for tinea barbae include having close contact with animals, working in humid environments, and using shared grooming tools that haven't been properly sanitized. So please do not share your razors. Treatment typically involves antifungal medications, either applied topically or taken orally, depending on the severity of the infection. Oral antifungal medications may be prescribed when the infection is more extensive or doesn't respond well to topical treatments. And now we get to your mental health and how your mental health can affect your beard. And one condition is called trichotillomania. Now, this is a mental health condition characterized by an irresistible urge to pull out one's own hair. It's classified as an impulse control disorder, and those who have it often experience tension or anxiety before pulling out the hair. And when the hair is pulled, they feel a sense of relief. Now, trichotillomania can involve hair from anywhere, like scalp, eyebrows, eyelashes, and other areas of the body. Trichotillomania of the beard specifically refers to the urge to pull out hair from the beard area. This condition can have various psychological and emotional triggers, and people who struggle with it may experience embarrassment, shame, or distress due to the visible effects of the hair pulling behavior. Now, managing trichotillomania typically involves a combination of therapies, which includes cognitive behavioral therapy. This is a common approach used to treat trichotillomania. It helps individuals identify and challenge negative thought patterns and develop healthier coping strategies. The other is habit reversal training. Now, this is a technique aimed at replacing hair pulling behaviors with more constructive actions. It involves learning to recognize triggers and practice alternative responses. In some cases, medications such as selective serotonin reuptake inhibitors or SSRIs may be prescribed to help manage the urges and anxiety associated with trichotillomania. And of course, joining support groups or seeking therapy with others who are experiencing trichotillomania can provide a sense of community. It's important to seek help from its therapists and psychiatrists. If you or someone you know is struggling with trichotillomania or any other mental health conditions, treatment can be effective in managing symptoms and improving overall quality of life. So now we get to the last part. How do I achieve a fuller beard? So one medication that you can get over the counter is Minoxidil. Now, Minoxidil is a topical medication commonly used to promote hair growth. Studies have shown that a 3% Minoxidil solution applied topically twice daily for 16 weeks can significantly increase facial hair growth by 9 times. Here's a general guide on how to use topical minoxidil for your beard. You want to choose the right strength. The minoxidil comes in different strengths, usually 2% and 5%. For beard growth, what I would recommend is to go for the 5% solution. One product that you can use is Rogaine. So make sure your face is clean and dry before applying minoxidil. This helps the medication to be absorbed properly. You want to apply a small amount, so apply 1 milliliter to the areas of your face where you want to promote beard growth. This might be patches or areas of thin hair. If you are using Rogaine, this is half a capful. Gently massaging minoxidil into your skin using your fingertips. This helps distribute the medication evenly and increases absorption. After application, wash your hands thoroughly to remove any residual medication. The minoxidil is usually applied twice a day, morning and night. And you want to let minoxidil dry completely before touching your face or applying any other products to the area. This usually takes around 2 to 4 hours. So you want to be patient and consistent. Beard growth takes time and you may not see results immediately. Give yourself around 4 to 6 months to see the effects of minoxidil. Some people might experience side effects like skin irritation, redness, itching, or dryness. If you experience any severe side effects, stop using the medication and consult your doctor. And keep track of your beard growth progress over time. So take photos to compare how your beard is evolving. Remember that results can vary from person to person, and not everyone will experience significant beard growth with minoxidil. It's important to manage your expectations and be patient throughout the process. If you have any concerns or questions, don't hesitate to reach out to your healthcare provider. The other medication that gives you a fuller beard is testosterone. Now, this can be topical or oral treatments, and it has shown benefits in promoting facial hair growth. Topical testosterone can be used in individuals with testosterone deficiency, and oral testosterone has been reported to aid facial hair growth in trans masculine individuals. However, diet and lifestyle can also give you a fuller beard as well. So, ensuring a balanced diet with adequate nutrition can help support overall hair health, including facial hair. It's important to note that any treatment for promoting facial hair growth requires patience. So, hair growth is a slow process and results may take several months to become noticeable. So, what about beard transplants? So, there's an increasing demand for beard transplants among individuals who desire a thicker beard, those with facial scarring or burns, and transgender men aiming to achieve facial hair growth. Beard transplants are often performed using the follicular unit extraction method. In this method, individual hair follicles are extracted from a donor area with high hair density, such as the back of the scalp. These follicles are then transplanted to the beard area. The other method, whilst less common, is the follicular unit transplantation. So, in follicular unit transplantation, a strip of hair follicles or tissue is excised from a donor area, i.e., from the back of your scalp, and then that area is sutured onto where there is patches on your beard. Unfortunately, this does give a residual scar. Facial hair growth from the transplanted follicles typically becomes noticeable within 4 to 6 months after the procedure. However, this timeline can vary among individuals. Now, in terms of success rates for beard transplant procedures, especially in terms of hair graft survival, it has been reported to be between 90% and 100%, which is quite good. However, it's important to emphasize that beard transplantation is a surgical procedure and should be performed by qualified and experienced medical professionals, typically dermatologists or plastic surgeons. Individuals considering this option should have a thorough consultation with their chosen health provider to discuss their goals, expectations, potential risks, and benefits of the procedure. So, beard transplants can be a suitable option for those who desire facial hair growth and have appropriate donor areas. However, as with any medical procedure, individual results can vary, and proper preoperative evaluation and postoperative care are essential for achieving the desired outcome. What I do suggest is to have a discussion with your health practitioner, dermatologist, or plastic surgeon about this. And we've come to the end of our beard topic. So, if you'd like an evidence based beard routine and treatment guide, then I've made a free guide for you to download. The link and information is in the description box below. And as mentioned earlier, if you do suffer from beard acne, then you may want to watch How to Treat Acne in 2023, a dermatologist guide. I'll put a link in the video somewhere on the screen.